So, Shinji, how much time do we have for questions and answers?
Given we're about half an hour behind, why don't we take a few targeted questions right now, and then we can open up for the broader discussion during the next panel. We can have the panel members respond to other questions as well.
All right. Are there any questions?
I just have a
Terry?
quick one.
Yeah.
If I could.
Hi, I had a question for Jason. I wanted to, you indicated that there was a group of people, and I'm looking for a stat here, Jason. You said that there was a group of people who had capacity. You said they could pull it out. What proportion can, quote unquote, pull it out of 100 people?
That depends on the disease at hand and the severity of that 100 people's disease.
So in the
So
context
if I take the paradigm I know is Alzheimer's disease, if I take a group of persons with Alzheimer's disease and I balance it evenly, a third very mild, a third mild, and a third moderate, I would say the data support that about 40%, in the cases of a research or treatment decision, which is what we've studied, about 30 to 40% of them would have adequate capacity.
Thank you. That's
If
very
I pack the group with moderate stage, that proportion would jump up. So it's very dependent on the overall severity of impairment.
Thank you.
And the audience member from the left?
Hi. I just had a very quick question, both from today and especially this last segment here. It really made me think of an issue I've been dealing with lately, and that's the one of health literacy and like low literacy rates, and if we're really assessing, and just if you could kind of comment a little bit on that and the
Yeah,
role it
so
plays.
I had a revelation about 2 years ago, which is much like the prose verse thing, which is people who study capacity deny literacy issues. You know, it's not an issue of literacy, it's about capacity. And people who study literacy deny capacity issues. And so you look at the literacy literature and they say, oh, well, the sample for studying this literacy measure, we're cognitively normal is defined by a mini-mental greater than, and they'll pick a cutoff, which arguably, in fact, admits people who are cognitively impaired, and vice versa. So the two fields oftentimes are measuring the same thing. I think sometimes when the health literacy world comes back and says, look at the prevalence of health illiteracy, I think what they're essentially saying is look at the prevalence of cognitive impairment. And I think on the other hand, when the capacity field says, look at the prevalence of incapacity, what they're measuring are troubles with literacy. And so the two fields, I think, have a sort of talking about the same thing, but measuring it with different ways and different language.
Well, how do you clinically troubleshoot that?
Well, how?
I'm making an assessment.
Yeah, well,
What's
so I
your
think a smart
recommendation?
clinician is
Do
very
I-
sensitive to what is the person's level of education and occupational attainment, because frankly, the fewer years of achieved education and occupational attainment raises issues that literacy could just as much be the issue here as the impairment in their cognition from whatever disease could be.
Education and job. Okay. Thank you.
Maybe this is
Last question?
Yeah, maybe this is implicit in what you've presented. The decision in terms of meeting all the various criteria that you discussed, I mean, should also be free of undue influence or any form of coercion.
Absolutely. So again, the definition is, you know, the voluntary choice of the competent or capable or whatever adult following adequate disclosure. And voluntary is this idea of being free of undue influence or coercion. I didn't talk at all about that, and I think one of the reasons why you don't hear it's a construct which is very qualitatively understood, but hard to measure. So there's not a lot of good research on voluntariness. You sort of know it when you see it that someone's not in a voluntary situation, but it's hard to sort of. There's no voluntariness scale that I've found. Like, oh, she's a 20 on the voluntary scale. We better step in. You know.
Sure. Yeah, I mean, particularly in the setting of an assessment in a home situation where there may be a caregiver that or perpetrator that might influence that. And finally, you know, expressing an ability to carry out a task that would indicate competence, there may still be a block in actually carrying out the task. I'm not sure how to.
So IADLs are ultimately, you know, I can talk about managing finances till they shut the microphone off, but ultimately it's okay. Well, here's your checkbook and let's work it out. And I think one of the, you know, Dan's work on financial capacity, a lot of his measures are demonstrative measures. people are given money and told, make change on this. They're given a little checkbook and, pay this bill. And I think that's the way you really want to assess IADLs. You want to know if someone can cook, go into their house, look at their kitchen, or look at their checkbook, or watch them drive, or whatever it may be.
Well, I'd like to thank the panel. This was really an intriguing and informative discussion of these issues, so thank you very much.